The difficulty in getting primary care for these individuals is the biggest problem. They often wait too long instead of getting primary care and getting preventative care. They wait because they can't afford medical bills. And so often things progress to a situation where they just have no choice, and then their options are usually emergency rooms.
Safety net clinics really provide a service that is really necessary. Not only do they operate many rural clinics where access to healthcare is hard to come by in rural Colorado, but in underserved areas like mine, like in Commerce City, where we don't have many primary care physicians. And so they provide that service because if they didn't exist, if they weren't here, those families would be going to emergency rooms. Thank goodness we do have safety net clinics in my area right now, because if we didn't, there would pretty much literally be no access to healthcare. The issue of healthcare in rural areas is a pretty easy one to understand for most folks. But access to healthcare in impoverished and underserved communities, I think, is a little bit more difficult to wrap your head around. You think automatically, because you live in an urban or metro area, that you should have very easy access to healthcare, but that's not always the reality. Like I said, in my area, primary care physicians are very hard to come by.
What I would like legislators to know about indigent care, uninsured care, especially the care that we give here at the Inner City Clinic, is that we have a responsibility. I feel we have a moral, ethical responsibility to take care of these people, and I believe that they deserve health care.
The most powerful thing to share with your elected representatives that can do something about this is to share your story. And so, I would encourage people who have had problems accessing health care in the past or currently to share those stories with their legislators, with their elected representatives, because that's the only way that issue is going to change.